And so for someone that got their beginnings in the health and wellness arena in the holistic side of things, being perhaps that aromatherapy book as your first, and now is also very much focused on the holistic side of things with, the holistic cancer coach certification. And I know what your mindset is now. How did it feel in that in between phase where you were going into conventional nursing before you kind of found your niche on the holistic side of things? Were you very accepting and did you very much enjoy the conventional modern philosophies that you observed in nursing? Did it always kind of feel not so right, but you just didn't know what to do otherwise? What was the experience like in that way?
It was exactly like the last one that you had just mentioned. I felt like, we were helping people, but we weren't fully helping them to the extent that we possibly could. There was so much more we could do. And so, I mean, we would do things in the conventional manner, but I'd always just feel like there was just more to it. And sometimes it didn't feel exactly right. That's actually why I didn't go into oncology nursing and infusion nursing. That's a whole nother topic. But yeah, as I was getting more and more into my practice, my eyes were actually starting to open a lot more. There were times that I was more on the conventional side, and I don't know if that's more like the training. They train us in a certain way to think a certain direction. And so you go along those certain lines, but you also have to have your critical thinking. And that's where it really comes into play is you have to have your critical thinking. And so once you start using that, you start seeing that there is so much more that we can be doing. And a lot of it is for times constricted in healthcare. I mean, you only are allowed so much time with a patient, so you don't really get to dive deeper into all of those things. Truly, probably most people should have a case manager or a chronic care manager when they're going through healthcare situations and in the healthcare field. Um, and so, yeah, I just always kind of felt like that was just a little off. And so when I joined the Holistic Nurses Association, I was just like, I could breathe. I found my people. I could like, oh my gosh, there are certain things that we can do. There are certain modalities that we can implement into their care. And, we don't have to just continually follow that conventional model. So there was this whole other section of us that did see outside and see that, maybe the direction that we're going is probably not, the greatest way to handle things. A lot of us were more like, what's the root cause? Like, what's causing a lot of these issues? How can we help people address them? How can we help people manage them? And I think that is a huge piece is helping people to see that there is that hope. The conventional model doesn't really do that. They treat sick or they treat like the injury or the illness acutely. Like that's just the way it goes. Um, but when you're trying to adjust things in a long-term management, that's when you really start to see that, yeah, there's a bit more of what we can do here. And I guess also too, like going through cancer myself, I had to dig through research and books. And I mean, I pretty much had to do it all on my own. Um, Again, like another DIY situation of my own healthcare. And so experiencing that as a patient and at the same time as a nurse, I could see where there were so many gaps in the healthcare field. And so that's actually what led me onto the road of becoming a certified holistic cancer coach.
That's awesome. And so before you found the, Holistic Nurses Association, would you say it was like most of your peers that also were on that same wavelength of you of like this isn't quite right? Or was that very uncommon? Were most very kind of conventional mind washed? Well,
Yes, they don't tend to think a lot of the same ways that those of us that are in that holistic mindset think. I was blessed to be able to work with certain providers and managers and surgeons and physicians that were open to that. So when I would educate patients, they were very open to me teaching about nutrition and lifestyle management and all those other holistic approaches. And so they were open to it, but to an extent, and a lot of that goes into I think one, training. Two, there's not really a big understanding that there is evidence-based practices for holistic modalities. It's just not a very widely known, fact or information. And there are still things that are in the holistic world that don't have that scientific research, but we've been using for thousands of years as humans. So I think it's just having that open mind to be able to see it. But yeah, I'd say the majority of my coworkers and peers were not on the same page that I was. I think sometimes they thought I was like the woo-woo hippie nurse.
Yeah. 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 The standard nurse archetype in society is certainly a fascinating one. To
Yeah.
keep it kind. What and so what does the Holistic Nurses Association do? Like, do you get specifically hired by certain hospitals or something as like, oh, we want someone from there, or do you guys just share information amongst each other? Like, what is being a member of that entail?
A lot of it is information and education, and then supporting one another. So if we have certain situations, we can talk to each other. There is just constant, nonstop support. And like I said, education and information that they put out there. So a lot of it is finding that there are a bunch of us that all have the same mindset, and we know that we all want to help our patients as much as we can. And they give us the tools to be able to support the patients that we're taking care of in a holistic manner. So they're very up to date on, new findings, new research, new ways of doing things, new different modalities, so different treatments that we can use. But I'd say a good portion of it is education and support. They do have conventions. There's also, they also have chapters and chapter meetings where I was at. I think I was like the only one, so we didn't have a chapter where I was located. But yeah, there's just constant community support. It's just wonderful.
And so how does it work? Like, say, you consult the Holistic Nurse Association, they let you know, oh, this might be a good idea, and you look into it, and it's like, oh, that might be a good idea for someone I'm working with. I don't really understand how, inter level hospital bureaucracy works. Like,
Mhm.
do you have the authority to then just go do that, or does it have to be an approved something somewhere, or like do you have to run it by the doctor? Like, how much freedom do you have to implement holistic modalities within a standard hospital setting?
That is an excellent question because it's all of it. It's all of it combined. So, as nurses, we have our own scope of practice. As a holistic nurse, we have our own scope of practice. But we also we have our own license that we practice under. But we have to follow the orders of the physician or the surgeon or the provider that we are working with that is taking care of that patient. So, whatever we're going to try to implement or would like to implement in a holistic manner, we do have to discuss with them and then get their agreement. Now, as far as a hospital setting, that's a whole nother level. There were, like I said, I was on a pain management committee. And so what we'd have to do is we would come together as a group. We'd get our ideas together, what we wanted to implement into the hospital setting. But then we would have to go and take that to different boards, different committees, the presidents, and then also different, there were like different sections of the hospital that we'd also have to get signed off on too. So it could
That sounds
be,
nauseating already.
it, it was very convoluted at times. There was one approach that we really wanted to implement. It's called battlefield acupuncture. They actually use it in the Army setting, and what it is it's a pain management. And they put acupressure, little gold pieces of acupressure points on your ear, and they stand for a certain amount of time, and it actually helps manage your pain. Well, because of not agreement on understanding of different or different perspectives on holistic management, we couldn't ever get that pushed through. That was just something that we couldn't get accomplished, and we tried. But like I said, there's all of the politics also involved in an organization like that. So you have to kind of go within their lines too. We did use aromatherapy for a while, and it was extremely successful. Patients loved it. but something had happened, and it was unfortunate. Just I think it was more of a perspective, and so we had to completely stop aromatherapy use for our patients. And it was like those living in, assisted living and hospice patients that were benefiting the most from it. And then, they're using it, and then you have to take it away. And it's like, I mean, so you have to still follow those lines. Like I said, I was blessed to be able to work with so many people that were very understanding, but there were also some that weren't. And I don't know, maybe it's just part of it is just a lack of education. I mean, truly. I did work with one physician that told me, I think they only had like 8 hours of nutrition in all of their medical training. So that physician was more than, welcome to be able to have me teach a lot of the patients, just even about nutrition practices. So like I said, we have to still follow within our own scope. We do work with our own licenses, but we also have to follow with what the physicians, the surgeons, and the providers are saying and ordering, and then also whatever organization you are a part of.
If you enjoyed this clip, be sure to check out the full episode I did with Marinette for a conversation about a whole lot of good stuff. We talk about her personal journey and the health challenges that she's overcome. We talk about holistic nursing and what that is. And of course, we talk about beatcancer.org and all of the wonderful things we do over there. We also talk about society overall and explore some interesting things that are going on in the world. So click the link in the description and check it out, and I'll see you over there.